It's a Wednesday morning. Let's talk some sports medicine and bring in our good friend, Dr. Joe Congini from Sports Medicine Center at Akron Children's Hospital. Dr. Joe, good morning. What do you have for us today?
Hey, Ray, I can't help it. I got two things I just want to mention, one real brief one, but I want to talk a little bit today about return to play. I mean, it's what all the sports fans are talking about in our region, about how you make decisions about when athletes can play or not. It's not just a thing with professional athletes or Deshaun Watson and all that. That decision is made every day in high schools, colleges, even youth sports, and it's every sport too. It's not just football. So I just wanted to go through. It's very difficult. It's probably one of the most difficult parts of sports medicine. So again, return to play is an inexact science, but I'll try to tell you what input we take to try to make those decisions. Number one, really important to us, is input from people who know the athlete the best. And the people who know the athlete the best in our high school settings and most settings is going to be the athletic trainers that are there every day working with these athletes. And they get a sense of how they are progressing through these different protocols to get ready to play. So we talk and communicate with our trainers. If they're in physical therapy for an injury, we talk to the therapist. They see very closely for an hour straight kind of how are these people progressing through strength and motion and explosion and balance, and they give us good information. Of course, the team physicians and the orthopedists have a lot of say, too, because they know the details of the injury the athlete has. Secondly, we look at imaging tests. So, of course, things like X-rays and MRIs and nerve tests and other even more complicated tests to try to determine what might be a reasonable time when that athlete would be ready to go back. And we try to tell coaching staff, is it going to be days? Is it going to be weeks? Is it going to be months? We can't be exactly correct on how many days it might be. We need a crystal ball to do that. But we try to get it down to days or weeks or months. Thirdly, we kind of follow trends that we know. There's injury patterns like, say, for instance, certain injuries, a lot of fractures might be 4 to 6 weeks, and ankle sprains may be 7 to 14 days before we can get them playing. But every individual is different, and everybody progresses through these functional progressions differently. So we have to take that into account. So number 5, you want to most importantly simulate what they have to accomplish on the field. In a gym setting, out on a field, in a therapy place, we need to try to reproduce that. So at the beginning, if it's a lower extremity injury, maybe they're just walking and tiptoeing and hopping in our office and we see how their strength and motion's coming back. But later on, we're blessed to have a very beautiful gym. We take people down in our center and we have workouts that we try to simulate the movement patterns they'd have to do to return to the field. And I have to admit to you, Ray, it's a little bit easier for lower extremity injuries, and we can watch them go through this. The one thing that's hard to assess is endurance. You just can't tell what's that person going to look like after playing half of a game or two-thirds of a game or near the end of a game. But we can simulate a lot of other things to get a sense with lower extremity. But shoulders and upper extremity, a little trickier. We have throwing areas and other areas that we try to use to simulate how the shoulder is returning and improving and whether these athletes are ready too. So there's lots of different ways. I do want to just throw in there, knowing that I speak a lot about concussions. I'll actually be giving a talk down in Columbus today at a big meeting of the Brain Injury Association. Concussions are the most variable injury we see. So they could be following a good pattern and drop off and do poorly, or not doing well and all of a sudden turn around. So concussions often don't follow those patterns. But we try to do all those things that I mentioned sooner. But then a little bit of a wild card is also, what is the athlete feeling? What can they tolerate? They know their bodies really, really well. So we have to take into account all 5 of those things that I mentioned earlier and then try to put it into every individual athlete. Where are they with where this injury is? And so I'm here to tell you it's not easy. It's probably one of the tougher parts of our job. we'll be doing it all day today and every day at Sports Medicine for every sport, not just football, like I said, trying to make decisions. And coaches want to know, of course, if we can get it to at least day to day or week to week or month to month for them, depending on the severity of the injury and how they're responding, that really is doing pretty well. But that's part of the process that we go through when we try to make decisions about getting kids back to play.
Joe, let me ask you this, and a lot of question marks have come about on this topic, going back to last weekend with quarterback Deshaun Watson of the Cleveland Browns, and he was medically by the doctors cleared to play. And that's where I want you to jump in. And it doesn't even have to be specifically about this, because I know you don't see the x-rays and all that stuff. But when a doctor says you're medically cleared to play, the other part of this is how the player feels about his body and the soreness. But clarify that for me. If he is cleared to play medically, talk about what that means and what goes into that decision.
You were right on target until the last part. Also, what you said was how they feel, soreness and pain, but also how they feel when they go through that progression of the things they have to do functionally out on the field. We cannot know what's going on with functionally, what it feels like to lift your arm, what it feels like to cut on a field, what it feels like to throw a ball 10, 15, 20 yards. Those kinds of things are individual. So the docs are making decisions about could they be made worse by way of the testing that we've done, the imaging that we've done. That's part of what they're talking about medical clearance. So I really here want to shy away from throwing anybody under the bus. And I know that, and I tell our trainers and PTs that too. We don't want to do that with high school kids. If they go out there and they can't do the skills that are necessary to play their sport and play their position, then we're not going to play them. That's all there is to it. Now, when we're saying medically cleared, okay, they may not make it worse by anything we see on the imaging tests and other things, but they have to be able to play and do the skills of the sport.
All right, that clarifies it.
One more quick thing I wanted to say, and you guys are great about this, but in the print media I didn't see much. In this monstrous football game that was played a couple weeks ago, so many people coming to my office didn't realize that, the ultimate play with 1 second to go in the game to win the game for Ohio State, one of the most watched games in the country for years, it was an Akron kid, Diamante Chip Trainum, who I think I know you remember. We talked about it. But so many people come in my office say, I didn't know he was from Akron. I got to see Chip Friday night. They were on a bye week. He's, of course, one of my favorites. I've taken care of him since junior high school. I don't think it would be bad to say he's doing great in school. He's going to graduate in January. He's doing everything right. And then he gets the biggest play of the big game on TV. He told me that when he first got the play was supposed to go to the right, and he saw bodies everywhere, and he just cut it up to the left and wanted to get across that goal line, and it will go down as an epic play. And it couldn't happen to a nicer guy. So for Akron people, let's celebrate the fact that the biggest play of that game came down to was an Akron boy, born and bred in Akron, Ohio, by the name of Chip Trainum.
And he just didn't take the ball and steamrolled ahead. As Joe mentioned, good running backs have the vision, and he saw right was closed, let's go left, and the rest is history. Good stuff, Joe. Thanks for joining me, my friend. We'll do it again next week.
Thank you, sir.
You got it. You too. Dr. Joe Congini, Sports Medicine Center, Akron Children's Hospital.